Hello, I'm Dr. Anuli, Associate Medical Director of Advanced Medical. I had the privilege of supporting a patient. He's a male patient who lived and worked in the Middle East and had contacted us because he had a fall and had back pain. As a result, he had sought care where he lived in the Middle East and had seen three different spine surgeons. He had had x-rays, a CT scan, and an MRI of the lumbar spine, and he was given three totally different recommendations by these spine surgeons. The first surgeon told him that he needed surgery urgently. The second surgeon told him that he did not need surgery at all. And the third surgeon told him that he could have surgery done, but it didn't have to be done immediately. The patient was thoroughly confused, as you can imagine, and had sought our help trying to clarify things and figure things out. I called him and we had a pretty good discussion. In talking to him, it turns out that he had actually had back pain on and off for years prior to the fall he had. He stated that the fall did aggravate the pain. He had tried physical therapy, which seemed to help a little bit, but then he relocated for work and had to drive 3 to 4 hours a day, and then his pain came back. And so at this time, he wanted to know if any of these three surgeons were right and how best he could move forward. So we collected all his information, including the x-rays, the CT scan, and the MRI of his lumbar spine, and we sent it out to two spine surgeons. One of them was a neurosurgeon and the other an orthopedic surgeon. They reviewed all the data, once again, including the imaging themselves of these x-rays, CT scan, and MRI, and they provided a report in response to his questions, and they sent the report back to us. I reviewed the report, we sent it to the patient, and then I called the patient and went over the report with him. So both experts agreed that the patient did have ischemic spondylolisthesis. They explained that this was a congenital condition, something that he had been born with, and so there was a defect in some of the bones in the back of the spine, and so the area in the back of the spine that connects that vertebra to the front of the spine was disrupted. Over time, it led to a fracture, and then as a result of that fracture, the L5 vertebra slipped forward on S1. They explained that he did not have to have surgery emergently or even at all at the current time because of his symptoms and because review of the imaging showed that it was a stable slip. They said he could continue with non-steroidal medications and that with the physical therapy, rather than doing the exercises he printed off the internet, he should see a formal physical therapist for specific exercises to include lumbar stabilization. They explained that if the patient always felt that his pain was relatively in control with non-operative treatment, he then did not have to seek operative treatment. The patient was thrilled to know in the first place that he didn't have to rush to the operating room, and also to know that there was a chance that he may not have to have a surgery depending on how he felt and if the spondylolisthesis remained stable. I was very happy to have been able to support him this way, and that's why I love what we do. Thank you.